to support this bill. Price disclosure is a very important and effective mechanism in ensuring that the cost of pharmaceuticals on our pharmaceutical benefit scheme is kept affordable, both for individuals who access those drugs and for the health budget. This is a sensible measure, it's an important measure, and reducing the threshold from 18 months to 12 months makes perfect sense. In fact, some people would argue that there's no good reason that the threshold could not be lowered even further. But this is a very important step in ensuring the continued sustainability of the pharmaceutical benefit scheme. It's going to save $835 million, and what that money does is it gives people access to new drugs, to drugs that would not otherwise be listed, to new services that may not otherwise be listed. So we, the Greens, certainly support this reform. The bill does arrive at a time when we are having a fierce debate about the future of Australia's health system. We heard talk in the lead-up to the election of a budget emergency. We saw the establishment of a Commission of Audit who were charged with looking for inefficient spending and for savings that could be made to the bottom line on the budget. The Greens, of course, have had concerns about the Commission of Audit inquiry, and it's why we moved to refer a Senate probe into the work of that commission. What we've learnt through that process is that everything is on the table, in the words of the Commissioner. We've been told that health is one area where savings must be made. We've had the proposal of a co-payment to access GP services mooted, and we heard the Health Minister invite an open and public debate on that issue. We've heard from the AMA that $400 million has been withdrawn from the nation's public hospital system. We have seen the defunding of ADCA, the Alcohol and Other Drugs Council, on the premise that the role of ADCA was being duplicated by other agencies, when we now know that in fact many of the functions of that council were standalone functions and have now been lost. We saw the dismantling of the star rating website on foods, which has been part of a worrying trend of secrecy in this government. One of the concerns is not just that the process for the dismantling of that website was secretive, and there still remain some serious questions about that, but the very act of denying individuals, consumers, ordinary citizens, access to information about the food that they eat is in fact, at its heart, a very secretive policy position. Surely there's nothing wrong with open, transparent, honest government, in the words of the Prime Minister, and that should also apply to ensuring that people have open, honest information about the foods that they're consuming. Now, we've seen all of those things in the context of a debate about health spending being spoken about as though we cannot continue to have the current health system that we currently enjoy, that health spending is unsustainable, that it's out of control, that we need to make deep cuts to health. And I think that proposition does need to be examined. Firstly, we spend, as a proportion of our GDP, about 9% on healthcare. That compares very favourably with other nations who have similar levels of economic development. In fact, when we look to the United States health system, we see a country spending twice what we spend, and yet having much poorer health outcomes and a much less fair health system. Health spending is projected to increase by 1% or so over the next decade. That is from 9 to 10% of GDP. But if economic growth is not to serve the health of its citizens, then why on earth do we strive for economic growth? The whole point of an economy that's strong, of an economy that delivers economic growth, surely should be to ensure that we're able to do what is really one of the primary responsibilities of government, that is to deliver good health care to all of its citizens. And our health system does very, very well on that front. It is efficient. Most of the increase in spending is because we have new, exciting, life-saving health technologies. That's hardly a crisis. In fact, it's the precise opposite. Most countries around the world strive to have the challenges that we have in health, and that is to fund new technologies that will deliver people longer lives, better quality lives, healthier lives. That is not a crisis. That's a wonderful opportunity, and we should be doing everything we can to meet that challenge. Of course we can look for savings in health, but first let's look elsewhere. We hear about the government's statement that we are now at the end of the era of entitlement and corporate, the age of entitlement. Thank you, Senator Xenophon. How could I forget? And the corporate welfare is now over. The corporate welfare is now over. Well, let's ensure that we match that rhetoric with action. Let's end the huge subsidies that are given to the fossil fuel industry, for example, at an era of catastrophic climate change. Why do we continue to subsidise the mining industry with things like the diesel fuel rebate to the tune of billions of dollars? Let's look at other areas where large corporations are the benefit of government largesse. We heard the Prime Minister talk about his support of the forestry industry only last night, when in my state of Victoria, the forestry industry is a basket case. It's propped up by government support, and if it was a private company, it would have been wrapped up many years ago. It is the epitome of corporate welfare, and it is an industry that does rely on government handouts. So let's look at those areas before we start looking at health, because most Australians consistently regard health as the most important area of government expenditure. In essence, if a government can't provide decent healthcare for its people, it can't give kids a decent education and can't look after the environment, then I'm not sure what we're doing here. Of course, there are some savings to be made in healthcare. We've talked about this bill, which goes some way to addressing some cost savings through the PBS. There are other potential savings through the PBS. We've heard about the potential for the increased use of generic drugs, for example, and incentives to ensure that people are opting for cheaper generic drugs, which are doing exactly the same thing as their branded equivalent. So let's look at providing more incentives in the system to ensure that generic drugs are prescribed at higher frequency. Let's look at the way we negotiate prices for medicines and examine the potential for reducing the total budget of the PBS by looking at some models overseas and learning from those. Let's ensure that we do the opposite of what's being proposed through the GP co-payment, which is driving people away from hospitals into primary care. Let's do that rather than doing what's proposed, which is put a disincentive for people to access their GP. It goes precisely in the opposite direction of all public policy in healthcare that we've seen over the past few decades. We should be making sure that people are accessing primary care ahead of much more expensive hospital services, and to do anything that compromises that important objective is to raise costs in health. Let's try and get better coordination of the system. Let's ensure that we have our primary care system, our hospitals, our allied health network working better together, and Medicare locals provide an opportunity to do that. And let's ensure that we protect Medicare. Some of the changes that have been proposed, such as the GP co-payment and such as the current initiative to allow private health insurers to insure services delivered through general practice, are some very significant nails in the coffin of Medicare. And we have to do everything we can to protect Medicare, to build it up, to continue creating more access to Medicare, because we know it's a very effective way of keeping healthcare costs down through a single public insurer, and a very fair way of delivering health services, rather than doing it what we're doing at the moment, which looks like an attempt to tear up some of the most fundamental pillars of our public health system and Medicare. We're at the crossroads in healthcare, Mr Deputy President. We have an opportunity here to protect and build upon one of the world's great health systems. But we are equally at a position where we may start to see some of the most effective tools for delivering healthcare dismantled as a result of some of the proposals that have been suggested through the Commission of Audit. I'm very worried about it. We only need to look to the US to see what a health system that's based on a user pays model, where we have a number of competing private health insurers delivering the bulk of health services rather than a single public insurer. We only need to look to the US to know what that leads to. It leads to spiralling health costs, it leads to people who no longer are able to afford health care, and it leads to a two-tiered health system, and that's not what the Australian health system was designed to do. It was designed to provide decent health care to everybody, regardless of their ability to be able to pay for it.